not a gourmet cooking. It pairs the art of food preparation and the science of medicine. It is the practice of helping patients use nutrition and good cooking habits to restore and maintain health. It's about teaching the why and the how behind low-cost, convenient, health-promoting, and delicious home-cooked meals and healthy eating patterns. The objective is to educate about the powerful influence that food has on health and disease. The goal is to establish skills in preparing meals with nutritional benefits and develop the habit of being a smart consumer, someone who would always consider what follows after every swallows. As we speak, more and more medical practitioners and lifestyle medicine service providers are seeking the certification in culinary medicine. And now, the Philippine College of Lifestyle Medicine finally brings culinary medicine certification course in Asia. It is a program with a blended curriculum composing of online and in-person modules that anyone can finish between 6 to 12 months at their own pace. There will also be a remarkable emphasis on chronic disease prevention and reversal, such as diabetes, heart disease, dyslipidemia, basing on published evidences. Bottom line is, culinary medicine is a course that should be taken by anyone who has the risk or who already have the chronic disease, where the cost is mostly within the control of our lips. See the link, register, and get your kitchen ready. This is our fourth session in this series of our seminar. I hope that you are learning something from every topic that we've been discussing each night. And tonight is an exciting topic, and I should say this is one of the most important topics that we should discuss, specifically here in the Philippines, because diabetes is already considered as an epidemic in our country. In fact, I have introduced to you at day one that Filipinos are highly affected with diabetes, and unfortunately, because of the chronicity of diabetes, because of its nature, people would always neglect their condition, and oftentimes they don't get themselves tested. And even if they get themselves tested, they don't in fact comply with the medications because they don't really feel physically ill. Okay, so because of the chronicity of the disease, you don't feel it doesn't bother patients so much, and so they won't put much attention on it. But let me say again that this is one of the scariest disease that anyone could have, because we also consider diabetes as the mother of many types of diseases. So it can brought about many different kinds of complications that you do not want to happen to you or to even to your loved ones. So like I have discussed with you at day one, I have showed you this slide already that 1 in every 5 Filipinos are already diabetic or pre-diabetic. So looking at the incidence and then the prevalence of diabetes in the country, and of course the projection of how many Filipinos will be affected with diabetes, this is really remarkable, and that every Filipino should be aware of how diabetes is developing and how can we prevent pre-diabetes from progressing to full-blown diabetes so that we can avoid complications. So if you noticed, now we already have the term, the diagnosis for pre-diabetes, because for the longest time we just tell our patients that their blood sugar is at the borderline, but now we already put a diagnosis for pre-diabetes, and we already have guidelines in treating patients with pre-diabetes, because evidences are showing us that complications in diabetes are already starting, or the onset is already beginning at pre-diabetes stage. So that means you don't need to wait until you develop full-blown diabetes before this complication happens. So unfortunately, oftentimes patients would visit doctors for consult who have diabetes. According to studies, most of them are already having 50% reduced function of their pancreatic B cells already. So that means their beta cells in the pancreas are not producing enough insulin anymore, to provide a good function for the regulation of the sugar in the blood. So as you can see here, Philippines is ranked fifth diabetes hotspot, and this is in Western Pacific region. So this is no joke, because diabetes is not only affecting adults, but this is equally affecting children at the same time. It's just that we don't get our children tested. We don't bring our children to get tested for diabetes. We just thought they are still a kid, they can tolerate sweets, they can eat whatever they want because they are kids. And unfortunately, to young people at the same time, sometimes they feel they are immortal, that they don't get any disease, and so they can do whatever they want, they can eat whatever they want. And us parents, we don't think that they need consultation or they need screening. Okay, so that's also one of the challenges and the barriers in the Philippines, because not all patients are actually going for routine screening, for diabetes. So you can see that there is a clear epidemic of diabetes in the Philippines. Now, it's important for us to define diabetes, and we can only do that using these numbers in your screen. So you need to know what normal blood sugar is, and then we have to know what pre-diabetes is and what are the numbers that will describe and that will define diabetes. So again, you'll never know your markers unless you get yourself tested. So a puncture of the needle is really necessary for us to get a sample of your blood, and then we bring them to the lab and then get yourself tested. Okay, so your fasting blood sugar is really necessary for us to begin with the diagnosis of diabetes. So the normal blood sugar should be below 100, and that's the goal. And the moment you reach 100 milligrams per DL, or that's about 6 to 7 millimole per liter, so that means you are already pre-diabetic. And so treatment would start at that stage already. So our goal with pre-diabetes is for you to reverse your condition, because we really have a good news in terms of reversal for pre-diabetes and some patients with diabetes as well. Now, if your blood sugar reaches above 7 millimoles per liter, so that means you are already diabetic. So we need to findings of this number so that we can say and diagnose patients with diabetes. So we also use this same measurement to monitor patients in terms of the treatment that we are providing them, like the intervention that we prescribe for them, to make us aware that the program and the treatment is working for the patient. So there are other tests that we do for diabetes, but this is the basic one that you can ask at the laboratory in cases like doctors are really far from you. So you can start off with your FBS. Now, if you can see that there's something wrong, there's an abnormal finding, then we highly recommend that you visit your physician so that they can initially start working on your condition. Okay, so let's say you don't have a laboratory close to you and you don't have doctors close to you. You can also look at some of the symptoms. These are classic symptoms of diabetes. So we borrowed the slide from CHIP. This is Complete Improvement Program. So this is one of the intensive therapeutic lifestyle program that we use in lifestyle medicine in helping patients get rid of chronic diseases. So again, going back to diabetes symptom, classic symptom includes frequent urination, feeling thirsty, increased appetite, so blurring of vision, and then they feel always tired. So typically diabetes are always hungry, they're always thirsty, and then they are always sleepy. Okay, so if you notice those symptoms happening to you or anyone in the family, so maybe that's the right time for you to get yourself tested and you go for consultation. Now I want to discuss here very, very briefly for you to know what's happening with diabetes. I want to show you here the function of your normal pancreas. Now, every time you eat anything with sugar, say for example, if this is rice or spaghetti, when you eat them, your pancreas is producing insulin so that the sugar that you can get from those food can be utilized for energy so that they can go inside your cells. Now, your insulin would act like keys so that that your sugar can get inside your cell, so they don't stay in your blood vessel, because that's the problem. Whenever your blood sugar stays at the blood vessel and then they don't get inside the cell, then it causes the complications. Okay, so here you can see in a normal person there's a lot of Ki. That means there's a lot of insulin, and so the insulin can open the gates of the cells, and so that sugar can get inside the cell. So that means they don't stay in your blood vessel. However, in patients with type 1 diabetes, their pancreatic B cells are not functioning, so they don't produce insulin. So that's why they are insulin dependent. So they get in injections, or they get a device so that it can replace the function of the beta cells of the pancreas. Now, with type 2 diabetes, which is composing over 90% of the diabetes in the entire world, usually patients are overweight, and then their pancreas are actually working very, very well. Unfortunately, in these types of people, it's either they get too much of the sugar, and then they eat too much of the fat, and so the culprit in type 2 diabetes is in fact insulin resistance. Now, what's happening here is that your pancreas is producing enough amount of your insulin, but unfortunately there must be something gumming up on those doors in the cell, so that the insulin is not working properly, and so that the receptors will not work properly. So here in this slide, I am showing you that the sugars are actually outside the cell. They are in the blood vessel, and we have there the receptor. The insulin is here. The pink colored substance here is the insulin. They get into the receptor, but again, the door is not opening up because of the fats inside the muscle cell. Okay, so this intramyocellular fat are the ones causing insulin resistance. So this causes the buildup of sugar in your blood vessel. They don't get inside your cells to be utilized as energy. So that's why you will notice patients with diabetes, they always lack energy, because the sugar that they supposed to have and they are supposed to utilize is right there at the blood vessel. It's not inside the cell for it to be utilized as energy. So that's how important it is to talk about fats again, because here in this study, you will see that in fact the free fatty acid elevation in your blood will in fact inhibit your insulin stimulated whole body glucose uptake after 160 minutes of your consumption. So that's why in diabetic patients, we always say every meal counts. It's just the same thing with hypertension. It's just the same thing with heart disease. Now, if you would recall, since day 1 and then day 2, day 3, and now day 4, we're still talking about fats here, right? So fat really has something to do with the development of chronic diseases in general. So here, this is already diabetes. When we consume free fatty acids from our diets, in just a matter of 160 minutes, they can already initiate insulin resistance, which is the culprit of diabetes type 2. And so now we know that it is insulin resistance that's the problem in diabetes type 2. And so this is a good news, because we can do something about it. If we can control and we can reverse insulin resistance, that means your blood can uptake your blood sugar again, so that you can reverse your pre-diabetes or your diabetes. So diabetes is a complex condition. Yes, we can provide patients with medication so that we can induce the pancreatic B cells, for example, to produce more insulin, but we're not in fact addressing the cause here. Now, what's good with diabetes is that the moment we implement what is recommended in the practice guidelines for the treatment of diabetes and pre-diabetes, we can help patients reverse or achieve remission in their condition. So here in the guidelines that I'm showing you, in fact, I've showed you this already during day 1 in our session. You will see here that the intervention and the foundation of treatment for patients with pre-diabetes and diabetes is lifestyle modification. Before we even give patients medication, we implement lifestyle intervention. We counsel patients and we motivate patients to start modifying their lifestyle, because food has something to do with the development of their diabetes, in the progression of their diabetes. It's not only the food, but having sedentary lifestyle and having a stressful condition in their lives will in fact determine the progression of their diabetes. So again, since this is a complex disease, even if we provide our patients medication, say let's start with one pill, and then we do not motivate patients and we do not implement lifestyle modification, tendencies are after several years, we needed to add another medication to the patient. So what you will realize is that you would start with one pill, and then eventually we will add another pill. Now you're taking two pills, and then eventually we will add another pill. Now you're a triple therapy, and then eventually you will end up taking insulin already. So if you do not want to develop that case to you, if you do not want to progress your diabetes, then this is the right time for you to start having a good mindset on what you can do to reverse your condition and to help yourself. So like I said earlier, I want patients to realize that diabetes is a scary disease. Now, looking at the complications that diabetes can give you, it's not totally worth it. There are over 80 patients dying of diabetes every single day, but diabetes can actually result to stroke. They can induce heart attack. They can affect your peripheral arteries. They can affect your eyes. They can develop cataracts. They can develop glaucoma. You can develop diabetic foot, diabetic nephropathy, diabetic neuropathy, so on and so forth. So that means if you have diabetes, as long as you have blood vessels on those parts of your body, they can be affected. Even your skin can be affected with diabetes. So, I mean, this is really a good time for people to be aware of what diabetes can bring to them. So yes, those sweets will temporarily satisfy their cravings, but the long-term effect of those sweets and those fats that you just ate and you keep eating is not totally worth it. All right, so this is a progressive disease that's affecting a person from head to foot. So why am I saying that diabetes and your feet? So this is actually the title of our session this evening. So like I said earlier, it's not only the food that you put inside your mouth that is influencing the development and progression of your diabetes, but the onset of diabetes is also related to being sedentary. So that's why here in treating patients with diabetes, we need to have a balance between the dietary intake and the physical activity of a person. We have to implement good physical activity. We have to motivate patients to have a very good physical activity, moderate physical activity, at least 30 minutes every single day. That's the optimum level. But at least if they can do 150 minutes of moderate physical activity, then that's already best for them, because physical activity may have the same effect of the metformin that we are prescribing you. So that's why we really do not allow, or we really discourage patients not doing exercise for maximum of 2 days, because the insulin resistance is creeping up. And then if this is coupled with a faulty diet, a diet high in saturated fat and a diet high in sugar, refined sugar in particular, then what's going to happen? Okay, there will be an increase of your blood sugar in the blood, and when we reach the plateau in the blood, that means that's the time that your blood sugar is up, it's not going down, then complications may happen. Now in this slide, you can see that every time a person would consume 40 grams of fat, that will increase the risk of becoming diabetic for about 6 folds already. Now it is really nice to know where we get our calories from the fats. Now you will find here in the slide that I'm presenting to you now, that there are so much things that people would eat every single day that is mostly composed of fat. So here's a very good example. Say you're eating beef sandwich steaks. So we thought this is lean meat already, but unfortunately, if you look at the calorie component of this is 70% calories coming from fat, for example. All right, so that's how important it is to look at the food choices that we serve people with diabetes. Now, I want to emphasize here one more thing, which is nuts. Now, you will notice that nuts are about 80% fat in terms of calorie. And so even patients with diabetes, we highly encourage them to consume about a handful of nuts every single day. Okay, too much of it will provide them enough amount of fat at the same time. Now here you will see this is another worst thing that you can eat, if you're a diabetic person. Now, if you consume about 4 ounces of unprocessed meat, this will increase your diabetes risk by about 20% already. However, if you take about 2 ounces, this is only 60 grams of processed red meat. So for example, this is your meatloaf, so this is your corned beef. This will increase your diabetes risk at about 50% already. So this is a result of a systematic review and meta-analysis that was already published in 2010. But again, we want to dwell with the good news, okay? Now here in this study, you will see that replacing one daily serving of processed meat with whole grain dish will decrease your risk of developing diabetes to 35% already. So that's how easy, to help patients with diabetes. We just have to encourage them, and first is to educate them on the food choices that they have. Now, the first goal in reversing prediabetes and diabetes is for patients to achieve their ideal body weight. So normally and most probably, patients with type 2 diabetes are already overweight or they are obese. Now, don't get me wrong, because there are other patients who are not obese. They are at their ideal body weight, but unfortunately, they are developing central obesity. So their bellies are actually the ones storing much of the fat. So our goal here is for them, in fact, to reach again their ideal body weight and then reverse their abdominal obesity. So our first goal here is to modify their food intake. Now I want to show you here one of the famous studies, and this is the Adventist Health Studies. Now you can see here that the moment you consume more plant-based diet, most likely you will reduce weight. And in this study, it shows here that the more you get into plant-based diet, the lesser your weight. This is for female and this is for male. Now, in this study, you will see a very clear relation of diet and the development of diabetes. Now, you will see here that diabetes is higher among non-vegetarian and diabetes is lowest among total vegetarians. So that means the more vegetable you take, the more whole food plant-based diet you take, the lesser the chances or the risk for developing diabetes. Now, this is a landmark study in terms of looking at meat consumption and the development of type 2 diabetes. This is the EPIC study, okay? So this is about over 1,600 sub-cohort on type 2 diabetes. Now, they were able to find out that in every 5% of calories from animal protein that you take, this will result to about 30% increased risk of developing diabetes. And then in this study, they also found out that vegetable protein is not associated with increased risk of diabetes. So with the evidences that I just shared with you, you will see here a clear inclination of our dietary choices with the development of diabetes. Now, if we just have a clear realization on what's happening in our daily lifestyle here, especially people living in industrialized country, living in the city, you will notice that people are always eating out. People are ordering food from outside sources, from the restaurants, from fast foods. And then even if we prepare our food at the house, the food preference, and then the things that we serve our family are in fact composed of lots of saturated fat, lots of refined sugar. And this only goes to show that nutrition literacy among Filipinos is really low. And that is the goal of our seminar, our daily seminar. And this is to inform you of the food choices and the food preference that people should have in cases like they are at risk of developing chronic diseases such as diabetes. And of course, we have to couple dietary choices with good physical activity. So we have a very strong campaign on physical inactivity, and in fact, the world now is suffering from inactivity crisis because everyone is just working while they are on their chair. Okay, so people love sitting, people love sleeping, and they hardly walk already, they hardly exercise already. In fact, every time I would ask my patient if they do exercise, for them it's really hard because you have to schedule your exercise. But the moment you use the term physical activity instead, for them it's kind of doable, it's kind of feasible. Okay, so we always mention increased physical activity. So that means do not allow yourself to sit over an hour. Say if this is already 45 minutes or so, you have to stand and you have to stretch and you have to walk a few steps, and so that you can help yourself have good circulation, and so that you can utilize those calories that you just ate. So our goal here is for you to have a good physical activity, and every single day, and this is 30 minutes moderate physical activity with strength training. So that means you're using weights. It doesn't have to be at the gym. You can use many different ways to use even your own weight to do physical activity, right? Okay. So this is the right time for patients with diabetes, patients with pre-diabetes, or have family history of diabetes to think twice. This is the right time to start changing and modifying your lifestyle, because studies show that the earlier we implement this dietary and physical activity, lifestyle intervention in general, the earlier we implement this, the higher the chances of reversal of diabetes and pre-diabetes. So I have here some videos to share with you. These are very, very good example of some physical activity that you can do at home. Having bad climate is not really an excuse. This is a seated exercise that I have seen from YouTube that I want to show with you here. This can be done by anyone, any patient with diabetes. So even if you're an elderly, you cannot go at the park and do your exercise, or you cannot jog anymore. And this is really good specifically for patients who are overweight and who are obese, because if you're obese and if you go for a long walk and say jogging, it will damage your knees. So we highly encourage them to do seated exercise to start with. So I hope the next material will be useful for you. You can search a lot more about this at your end, and so that you can also incorporate this in your daily physical activity. Now, another video here that we will be playing is a recipe coming from Culinary Medicine or Culinary MD Asia. So this is sharing you another recipe you can start at home. So how do you make a tweak, and how do you improve preparation of plant-based ingredients so that you can actually come up to a very good recipe that is palatable and that is delicious, and so that you can sustain your new healthy lifestyle.
Hi, I'm Coach Nicole from SparkPeople.com. In this video, I'll lead you through a cardio routine that you can do from a chair. Hopefully you're using a chair that doesn't have wheels for safety and one that doesn't have arms so that the arms don't get in the way of your movement. So doing cardio from a seated position is a challenge. I want you to follow along to the best of whatever your ability level is. If you need to go slower or go faster or change the range of motion to do whatever works for you, then that's what I want you to do.